Very good afternoon to you. So before we start with anything, I would like to know your name and where are you practicing, and it's been how many years you're doing this?
Hi, I'm Dr. Jayesh, Dhabalia, practicing urologist. I've been practicing urology for almost like 30 years now, and I'm stationed in Mumbai, western suburbs, Kandivali.
So today we're going to be talking about BPH. First question I have for you is, why according to you are the cases of BPH on rise?
There are basically two reasons. Number one is increased awareness, and second, increasing lifestyle. Now, increasingly, the common lifestyle changes which we are talking about are also a reason for increasing in the incidence of BPH.
Okay, next one is, why does it become so important for the condition to be diagnosed in its early stage?
Uh, at present, we have two kind of treatments for BPH. One is medical treatment where we use various kinds of medicines, and other is a surgical one. Now, last 20 to 30 years, there are some good inventions and good medicines which have come up and which gives good results. So, if we can diagnose them early, we achieve two things. One, we can reduce the number of patients who require surgery ultimately for that treatment, and second, we can also reduce significantly the complications which arise out of BPH and its problems.
Okay, talking about surgery, when does surgical intervention become necessary and can it be avoided?
It's not a question of avoiding surgery or not avoiding. I would often say that it's not that medicines are good or surgery is good. Both the treatment modalities have their fixed place. So initially, early stages, definitely medicines work well, and in almost 50% of cases, they are able to avoid surgery. And when it becomes clear that medicines are not working, or there are some complicating factors like recurrently infections or kidney functions are getting disturbed or recurrent bleeding and all, then we go for surgery.
Lifestyle modification that are must for the people between the age of 40 to 50 to avoid BPH.
Why? As we said, lifestyle modifications are important to actually reduce the number of people who are going to suffer from this, and that's why certain modifications like having a healthy exercise, regular diet, and reducing the amount of fat, and the overall picture, what in medical terms we call it as metabolic syndrome, where we include blood pressure, diabetes, your fatness, your exercise level. So all these things definitely help in reducing these problems. So that's why people should follow them.
Lastly, any message for all the upcoming urologists?
Urology is rapidly expanding with some specialties, subspecialties. There are a few things which are going to stay back and which everybody would have to treat. And BPH, or benign prostatic enlargement, is one such thing which is going to be ever there. And with increasing longevity of all the people around around the country, definitely we'll see more and more number of patients suffering from BPH. So BPH, its awareness, treatment, and follow-up is definitely important, and all of you should remember that.
Okay, well, that's all. Thank you very much for your time. Have a great day ahead.